Hi, I'm Dr. Shilpa from Bangalore. So, today we will talk about what makes you have an high risk pregnancy. So, there are two things which can happen. One is either you have a pre existing condition which can be there even before your pregnancy, and you get pregnant with that, and then it is a high risk pregnancy, or there are certain problems that you get during pregnancy, and then the pregnancy becomes high risk. So, to begin with, you will be a low risk one, and then because of this condition which happens during your pregnancy, you later get transformed or converted into a high risk pregnancy. So to begin with, we'll start with what are the pre-existing conditions which can be there. So one is you could be a thyroid patient who is having hypothyroidism, who is on thyroid medications, and you can become pregnant, and you will still be classified as a high risk pregnancy. You could be a patient with an existing diabetes, existing high blood pressure, that is hypertension, or you could be an obese individual who is overweight who gets pregnant. So these are the ones which are commonly seen, and you could be anemic and then you become pregnant with your anemic status, and you could still be a high risk pregnancy patient. So whereas in terms of the problems that can happen even when you don't have anything to begin with, but during the course of pregnancy, because pregnancy is a 9 months, 7 days long duration. So during this time, if you get any of these complications, then also you are termed as high risk pregnancy. So one is if your hemoglobin keeps falling during pregnancy because of the increased demand from the baby while it is growing inside, and if your hemoglobin falls below 11.5 at any point during pregnancy, then we call it as high risk pregnancy. Or because pregnancy is high in hormones of estrogen and progesterone, and this can cause changes in every cell of the body, and it can change metabolism in the liver, kidney, and everywhere. So because of this, there will be changes which can lead to increase in the sugars in your blood, which can be termed as gestational diabetes, or it can cause increase in your blood pressure because of the placental problems. This can also be a high risk pregnancy. So this is coming to the mother. So what happens to the baby? So if the baby is becoming bigger and bigger in spite of you not having any problems like the mother, it is still a high risk pregnancy, because we will have to tackle the problems of a bigger baby during delivery, if at all, if we are planning to do a vaginal delivery. If the baby is not putting on enough weight, then again it is called as IUGR, that is intrauterine growth retardation, which definitely requires more monitoring in terms of pregnancy care, and that is also a high risk pregnancy. So the other not so common factors which are there, which are incidental, could be either you can be diagnosed as short cervix, or it could be a placenta being low down called placenta previa. So all these things are also classified into high risk pregnancy. So conceiving with fertility treatments, especially IVF, is termed as high risk pregnancy, because it's a very precious pregnancy and we don't want any problems to the mother or the baby. So ultimately, any high risk pregnancy should be dealt with utmost care, and it definitely requires a lot of effort from the patient and the family, and also from the obstetrician, to make sure that there is the best of the outcome for the mother and the baby in these conditions. So there are other varieties of problems, like having more water around the baby, less water around the baby at various gestational age, which can be termed as high risk again. So whatever it is, any high risk pregnancy should be dealt with utmost individualized supervision by the obstetrician. And if you have any more queries, you can post them on the comment box. I will try to answer. So if anything else, you can consult your healthcare professional or your obstetrician for further information. Thank you.